Hello. No one really wants to think about or talk about going to the doctor. But when you need one, it is so helpful to have one that you already know and actually trust. It's not uncommon for a person to struggle to find a good primary care provider or to have the one that you adore retire, move, or just change professional interest or focus. This video helps you think through how to find a great primary care provider with 7 action steps to guide you through the process. At the end, I'll give you a free resource to make it easier for you to rate your experience with your doctor and make informed choices. First of all, determine who's in network. Most insurance companies in the United States have an in-network provider or list of providers that you can choose from. If you choose to go see these people, the copay or the amount that you might owe to go see this person is usually lower. Secondly, look for expertise that meets your personal needs. Family practice providers usually treat people of all ages. They are generalists who can treat a wide variety of conditions, and sometimes they have some specialty areas that they practice in as well. Internal medicine providers usually treat adults and specialize in the prevention, diagnosis, and management of disease or chronic conditions. General practice physicians are much like family practice physicians in that they can treat people of any age. This category is one where you may also find osteopaths. They're distinguished by not having MD after their name, but DO after their name. These are physicians that can practice a type of alternative medicine that focuses on the musculoskeletal system. Third, I would encourage you to ask for referrals. It never feels more comfortable than when you ask a trusted person that you know, a friend, a family member, or a provider, who they might recommend and why. You can also look at online reviews, of course taking them with a grain of salt, knowing that some people go online to vent emotional distress more so than comment on their providers. But online reviews can give you some great data, such as how well patients trust the doctor, the amount of time that the doctor spends with patients, or how well they answer questions and communicate. Fourth, I really want you to think about logistics and preferences. Although a lot of people say, oh, I'll go anywhere for a great doctor, which may be true, oftentimes people are deterred by seemingly smaller things. Driving really far for a primary care doctor visit? It sucks. Crazy traffic and parking? No thank you. Doctors who can only see you on Mondays and Tuesdays? Not convenient. Doctors who work with hospital systems where you don't want to go? Nope. Think about the logistics of your primary care doctor and their environment. If you don't, you might find a great provider, but there are so many deterrents that you end up not going and using them appropriately. Also, make sure that you think about any language considerations you might have. If your primary care doctor doesn't speak your language, it can be so much more difficult to communicate clearly or get the advice and recommendations you really need. Also, many providers have added online telehealth as an option in their practice. For some people, this is a godsend, a wonderful option to make it more convenient for them to get care. For other people, it's not a great option. They don't prefer it and don't want to feel pressured to use that as a form of communication. The fifth step, check your doctor's background. By this point, you've narrowed down your list to perhaps 2 or 3 providers that look promising. Feel empowered to look them up and check their background and training to see where did they go to school, are they certified in certain things, and so on. If you're looking specifically for a geriatrician, board certification in geriatrics is often a really good indicator to assure you that they have the training and skills necessary to meet your needs. You can also look up to see whether or not a person has had any disciplinary action taken against them. This is easily done by going to your state's medical board website. I typed in Oregon Medical Board and quickly came up with several different options for checking on licensing, certifications, and whether or not there was any investigation or disciplinary action. Next, It's coming down to the time where you just need to go meet them. The true test of a relationship really is how well you interact in person. Feel free to take an interview sort of a mindset where you're considering to yourself, is this person a good fit for me? If you're not sure, it might make sense to give it a few more times before you decide. But if you're feeling badly after even the first interview and you don't think it's a good fit, it would likely make sense to move on and try for another provider. There are several aspects that you may want to consider when you're choosing your provider and you're going to see them. 1. Is their staff friendly and compassionate? Nothing is worse than when you go into a doctor's office and they frown when they see you or shake their head or appear to not want to be there at their job. We understand it can be really stressful and hectic at a doctor's office, but we want people who are warm and friendly in the process. Does your doctor get to your appointment on time? We all understand that the days can be hectic and some patients need more time and care, but on average, is your doctor on time and respecting the time investment that you've put in to come and see them? Do they listen? Does it seem like they actually want to get to know you and facilitate a relationship? Are they accessible? When you ask them, gosh, if I have a question, how would I reach out? And they direct you to call the main number and make an appointment to come in, it may not be a clinic that meets your needs in terms of accessibility for a quick question. Does your doctor communicate clearly in a way that you can understand? As you're having conversations, does it feel like your provider is empowering you to make decisions that actually work for your life and your body? It's great that they have knowledge and medical ideas and science behind them, but if it doesn't work for your particular situation or they don't communicate in a way that helps you understand why they're suggesting something, it won't be useful. When you're interacting with your provider, do they help you feel comfortable and do they make you feel like they care? One gauge of this is to pay attention to whether or not you feel comfortable asking questions. If not, it could be an indicator that you're not really comfortable in the relationship. As you're talking to your provider, does it feel like they're listening openly without being judgmental? Nothing's worse than sharing sensitive, private information and being really vulnerable with someone than the sense that they're secretly judging you and making assumptions about you and your lifestyle. Finally, do they call you back? When you have a question, whether it's urgent or not, do you get a response from the clinic in a timely manner? This can make a big difference in whether or not you feel supported by your care team. My last point is to trust your gut. Yes, it's important to look at all the factors we outlined in the last step, but at the end of the day, if your gut is telling you something is off and you really don't feel comfortable with this provider, then listen to that. It doesn't make sense to force yourself to work closely with somebody who could play an instrumental role in your health and your future if you're not comfortable with interacting with them and sharing who you really are. Now you know how to find a great primary care provider. If you still have questions on how to talk to that provider about concerns you might have, such as having memory problems or other cognitive difficulties, feel free to watch my video on that specific topic of what to do and how to talk to them in a way that really meets your needs. I appreciate your coming today. I can't wait to see you in the next video.